This is how we take the boot off. Undo it, fold it back on itself so that the Velcro doesn't stick everywhere. These three come close to the inside of your body on my right foot. And these go in the other direction because it's easier to bring them back on this side than try to wrap around and get them on the outside. Open this up and your foot should come out just like a banana peel. No pressure on your toes, your ankle, your shin, whatever's injured. You will see some of these unravel. You can pull them all the time, but it keeps happening. You don't have to worry about it. You can buy new of these new Velcro bands if you want to. This one has an inflatable set of cushions inside, so if you open it up, squeeze it out, it empties like an inflatable raft. And where it's going to inflate is right in here and right in here. So let's inflate it and you can take a look at it. You tighten this knob up here and start pushing on this button. And you can see these little sides here. So they're full of air right here. That does help a lot. It helps keep your heel away from the back, especially for an Achilles surgery or anything on the back. You don't want it pressing up against the back of the boot because it hurts. So you get a little air inflatable pads that help a little bit. They're almost touching now. They're cushiony. When I came out of the surgery center, they gave me this kind of sock. Like a compression sock. It's really soft too. And my foot was really tingly and sensitive and painful. I have to wear this boot to sleep in. My foot gets really hot. So I did two things. I bought another pair of these socks on Amazon. And I cut the toe out. Got some iodine on here. And then I put the sock on backwards. And so the top part of the sock will grip a little bit. That fits my calf. It helps keep my feet and toes and everything a lot cooler by having some breathing room. I also had one pair of socks that worked well. Don't know where I got them, but they're, a shin type sock, but they're very loose and wide open. And I put those on and they felt really nicely also. So they're very comfortable, very soft. I don't feel the seam up here. You feel everything with your foot, especially right after surgery. So that's what I've done. I've got that one, the regular compression sock, and one I cut the toe out of, put it on backwards. This is the boot when you get it. And when you're trying to assemble it, it's a hard frame plastic with a couple attached straps, and then these vertical pieces of metal, and they have Velcro on both sides. And it's very difficult to put this in there and get it started to wear. What you're supposed to do is put it on your foot and push it down. It's immediately going to grab on to these sides right here. So what I've done is I have these pieces of cardboard that are taped together. I put them over here. And I even want to put it here. I don't want to grab it anything, so I'm just going to put a little tape on that now. I'm just going to cover that Velcro because I don't want it touching the sides of this boot insert. It'll stick very significantly. Okay, now we put this on our foot and then strap it up a little bit and lay the foot in there. We want to get it to align so that insert goes all the way into the back here. You can use bubble wrap tube or saran wrap or plastic wrap or whatever just to cover up the Velcro binding. One thing different on my boot is I have to wear this 3-layered wedge, heel wedge. I have to always have my toes pointed down the first 7 weeks and then pointed horizontally for the next 5 weeks. So that's 12 weeks. At 7 weeks, I'll be able to take, and then 2 weeks later, I'll take 1 layer off, and then another layer off, and then the 3rd layer out, and then it'll be just a boot in the insert. So I have to go down gradually and put weight on my foot. And for now, I'm with the 3 wedge insert. That has to go in the bottom. Lay it in here, biggest wedge down, put it all the way to the back. Now I'm going to put the insert on my foot and slide it in there. So I have the insert wrapped around, and I'm going to put it in. That's exactly where I want it. See, it's all the way to the back here. So I'm going to put the boot in. I want these arms to align on these pads here. So I can get it unaligned. So if I line it right here, got my foot all the way back. Now I can take this cardboard off, press on the inside, and I missed it. See what happens. There we go. I'll do the same on the other side. This one is aligning a little better. All right. So that's Velcroed on here to hold it down in place where I want it to go. Now let's reassemble the straps. It goes on the inside like that. This comes across. And this strap comes around behind, again over the Velcro here, and over the Velcro here on top of this bar. It's going to go in. You can see how it has to align, so I have to come down a little bit. And we'll keep them pretty snug as we're getting it set up. Come across the back, push it in, snug it up. One more across the back. That's a little off. Move this one up. There we go. All right. Now on the bottom ones, this aligns also. There's a little piece of Velcro. Push that on. Here we go. Boot's ready to go. Sometimes I loosen the tops up because it's very constricting. These two are the most important ones to hold your foot in place. You make your toes come up, loosen that up, and this. If it's uncomfortable at first, I would focus on putting the correct sock on. For me, I had to sleep with this. My boot didn't touch the ground outside off the scooter, so I had to sleep with it. And I'm going to tell you, it wasn't very comfortable for me. I'm a light sleeper. If I have a little shooting pain, either from the injury and the surgery rather, then pressing in the back here, it would wake me up. So a little bit of a mental challenge to get through that. And you have some adjustments, but you don't want your foot flopping around. You need to keep your toes pointed downward past the horizontal. And that's what this boot and the straps are intended to do with that wedge inside of there. I'll pump it up a little bit. Keep my heel off the back. I can feel it tightening up all inside of here and putting more cushion. Here we go. This boot is going to be your best friend when you have an Achilles surgery for months. You can buy new straps. You can also buy a whole new liner. It starts to get funky. Mine hasn't. I think the liner I saw was about $20 something online, a couple places. Yep. But the idea of this is to protect your foot protect the surgery and protect it while it's recovering. The body's healing itself.